Silver Edition with your host, Silver Injector, and I have the lovely, the amazing Morgan Zwicker with me. She's with the Glow Lab in Halifax. She is honestly one of my favorite injectors. I'm sure as an aesthetic practitioner, you always have those buddies that you send memes to. Morgan is definitely that for me. Let's talk about how we met.
So we met, I came to Moncton for my very first training course, which was held at Bloom. And you happened to be there and you came in the room and we got chatting a little bit. And you mentioned that your maiden name is Zwicker.
Yep.
So we made the joke that we were cousins along the line, but I actually, a few months ago, went to my grandparents' house. They had a book about this big of Zwicker history. So it turns out we actually share the same like fourth great grandfather. So we're cousins.
It's official.
Obviously, obviously we're related somehow. We're like
I feel like
the same.
anybody, honest to God, anybody on the East Coast, like there's some kind of connection.
Somehow, yeah. And like Zwickers are all like, yeah, we all came from the same guy. So
Yeah, and it was our great grandpa.
we've been DMing back and forth ever since. I probably found you like a little bit after the course, like when I was getting started.
And how do you find your nurse practitioner? Because right now you live in Halifax. You have a nurse practitioner that oversees all of your medical directing. How did you stumble upon the beautiful, lovely Christine?
She essentially, I refer to her as the angel that fell into my lap because literally manifestation. I was looking and looking everywhere, messaging everywhere in the city, like, let me scrub your floors with a toothbrush for free. Just let me get my foot in the door because it is so difficult in this industry. Crazy. So I somehow stumbled upon her Instagram account one night on a night shift. And at 3 o'clock in the morning, how professional, I emailed them and I heard back from her a few hours later when it was the morning. And she had told me, I literally just messaged them to see if they knew anyone who knew anyone, because obviously you have a province specific license, and they were Ontario based. So I just messaged them, throw me a bone, sort of thing. And she said, I actually just got my license in Nova Scotia, and she's sort of living here back and forth part time, so it works out perfectly. And I was her first injector here. She has a whole team in Ontario of like many, many nurses and nurse practitioners. She's fantastic. Love her.
She is.
Yeah.
I've honestly, anybody that reaches out to me and is looking for a medical director in Nova Scotia, I'll message her and say, are there
Me
people
too.
that,
And it's always like a different answer every time. She's so busy, right? She's doing all the things. But yeah, I think we're looking for another NP here to help out.
Ooh, that might be just kind of a segue to be like, hint, hint, wink, wink, nudge, nudge kind of thing.
I'm just happy. Like I love having her to like oversee me. It feels so safe, and yeah, I like the fact that I have someone to do my consults and stuff like that, and I'm not solely responsible for everything.
It's nice to have somebody that you can rely on to talk to, and especially in that position. Well, I have my medical director. You met Jen, and
Yeah, love Jen.
right, like I just love that we have such supportive.
We are so lucky. We really lucked out, both of
Honestly,
us.
so like, which brings me to the topic of discussion, which is basement.
Speaking of medical
Speaking
directors,
of medical directors, and when people wouldn't have one, basement injectors, and what that means. Well, what it means to you when I say a basement injector. Like, what does that, if you think of a basement injector, what would you describe that person? Like, how would you describe that person?
a basement injector to me is someone who is unlicensed, so they're not a nurse, they're not an LPN, they're not an RN, they're not a dentist, nor a NP doctor. So anyone who is practicing illegally.
Illegally. Essentially, that's what you're doing. Because medical aesthetics, what we do as healthcare providers, is just that. It's medical consultations, it's medical treatments. This is not something that, skincare, we're just gonna put a little on our face,
No,
those kind of things. Like
it is no joke.
we're going in depth, and there needs to be very clear instructions on like what's going on with patients. We need to be mindful of patients' anatomy. There's always ongoing learning when it comes to aesthetics. And I feel the same way. These people, these basement injectors are people that are not licensed to practice medicine in any capacity at all. Whether or not, well, here in Canada, should I specify that? Because
Yes. Mm-hmm, mm-hmm,
from
mm-hmm. We
another
should
country,
specify.
some people come from another country and they think that they are, well, they think they have degrees or certain education from other places in the world, but they are not recognized here in Canada. So just because you hold a degree or a medical background somewhere else doesn't make you eligible to practice these things here in Canada legally. So that's a basement injector to me. And it's happening here in Canada, which is terrifying. And maybe I'm naive on thinking that this is our little cocoon of our Atlantic cocoon where you think of all those things that happen. It's always
And
in
you're like, not
Ontario,
here. That wouldn't happen here.
BC, but it is happening here. I have my own personal.
Well, not right here, but like here in Halifax.
There in Halifax, there's stuff that is happening like literally 20 minutes, 25, 30 minutes outside of the Moncton area where people are practicing in their homes, ordering products from God knows where, and offering their friends these injections. We don't know where it's coming from. We don't know. They're like, let's just have a little Botox party and we'll hang out and I'll just poke you. Like, where are you getting this stuff?
Yeah, so just to be clear, everybody, in order to order legal Health Canada approved product from a supplier, you need to hold a license. So where else could these people be getting the
And
product other than,
right? Even
well, not
as
AliExpress, but you get the gist.
I'm sure you've seen horror stories on TikTok, Instagram, any kind of social media form where people have purchased um, unapproved product and used them in their own faces. Ugh.
So this is a huge issue in the UK as well because they don't have any sort of regulation over there when it comes to fillers. Same with, I know you made that reel recently, Texas. There are a few places in the US where you only need to be an esthetician to do injectables. So yeah, super scary stuff.
Yeah, Utah as well. I follow an injector. God, she's the sweetest person on the planet. Um, I follow an injector in Utah, and she just messaged me saying that it's not only in Texas, it's in Utah too, which is crazy to me that people would go looking for basement injectors. And like, why do you think they're looking for these basement injectors? Like, what's the pull?
Better deal.
Do you think
Better
it's just
deal.
pricing, which makes you as a, as a consumer, it would make you want to wonder why these prices are so low. Right? What, like, why? So then I'm like,
Because if you're getting your Botox for say $5 and $6 a unit, your injector is either losing money by treating you or using
100%.
counterfeit product.
And
Let
that
that
is freaking scary. If you ask me, that is terrifying. And the reason why it's terrifying is because, like, if you're receiving injections by unqualified individuals that have counterfeit products, you don't know what you're putting into your body. You have no idea. And neither do they. Well, maybe they think they do, but there's no way they have access to these kinds of things.
and then
And then
if something were to go wrong, they don't have access to prescribe the appropriate treatment and refer you to the appropriate
Outlets,
yeah, no,
right?
outlets. You got me.
But my thing too is, and I'm going to bring it back to Christine and to Jen, who are our medical directors. Those are the people we rely heavily on when things start to kind of go in a different direction, right? We rely on them for product because as nurses, we can't, without a medical director, purchase product here in Canada. And not only that, but
We can't inject it. Even in the hospital, we cannot give a Tylenol to a patient without some sort of medical directive or an order from a physician. Botox is a prescription medication.
100%. And so there are obviously, I don't know in your practice, and I wasn't planning on going down this route, but here we are. But obviously, in your practice, you have standing orders, like I do. There's a certain amount of Botox that I can utilize within like seeing one patient, and there's a certain amount of filler that I'm only allowed to inject at one time. So I have my
Parameters.
wheelhouse. Yeah,
Yeah.
exactly.
Yeah.
Look at us.
Look at us. Oh my god. The bloodline is strong.
Right? These Zwickers, we're pretty. No, but it's so true. But there risks when we were talking about, and I feel like we could go on and dive into pricing and risks associated with lower cost pricing too, is because there's always going to be that balance, right? If you're paying even a license per, like, let's say injector, a lesser amount, then you are compromising on education experience. So like if you're paying less from a basement injector, then you may be missing out on education experience, but not only that, but then your product. And you have to question those things. So that's where it starts to become unsafe. And that when we're looking at adverse events that can occur with unknown products or even with known products, how they're going to work these things out.
Yes. And I think we really need to discuss this because I've seen plenty of clients who have gone to these basement injectors, and a lot of people don't care
They
what's going
don't.
in their face. And it's quite unfortunate because that obviously means you're not educated on the true risks and um, side effects that you could experience from injectables.
I often find that people find things on the internet and they refer to them as like the worst case scenario. Like, you know how most recently, and I'll put a link on that lady that had Botox injections for migraine. I don't know if you've seen that. She's in the hospital and everything. I'm sure you have patients that reach out to you every single time things like that happen and they message you and they're like, well, could this happen to me? You never told me about this. And the reality of it is that that is the worst case scenario, high volumes of Botox. But with that being said, if your injector is not educated enough to be telling you and having those discussions with you, if those things come along, you're just going to be like, right? But these are the kinds of people that decide that they're not going to go with Botox because of that. You know what I mean? Like they're like, oh, maybe I won't go with that because these things can happen. Where if you go to an educated practitioner is going to say the risks of that are those high doses, injection area. We don't know all the information about that. So
Someone made a really good video recently talking about like the different injection points and risks and such, and there is a much higher risk of those side effects when you're injecting different areas, especially like in the bladder, for example. So, but
it's
we
crazy.
we are using much smaller doses than that and different areas. Not to say it could never happen, but um, things definitely get misconstrued there.
I would much prefer a patient come to me, and this is something, if you're a consumer, what you can do to kind of avoid those basement injectors is ask how long you've been in the industry. right? How long? What other training are you doing? I know that people say this all the time, but I'm not. I think only through a handful of times that I can think of my clients asking me how long I've been practicing and what I've been doing for education.
I feel like I get asked that more often because people know I'm like, we'll get talking about age, and I'm 24 years old, right? So, like, obviously, I haven't been practicing longer than I've been graduated nursing school. So, people are always like surprised, I guess, and just kind of ask, like, oh, how long have you been doing this? Not sort of in a how long have you been doing this way, but more of like a, oh, good for you. How long has it been? So, but no one really comes and they're like, what is your background? Did you take a course? Can I see your nursing license, for example? Another thing I will say is anybody can Google your licensed nurses and physicians on the College of Physicians of Nova Scotia or New Brunswick. Is that called that there?
I believe so. I'd have to ask Jen.
Ours
But
is
I
the
know
NSPN. Anyway, you can search first and last name, and it will show you how long they've been licensed for. Any if there's anything against them, and whatnot. So your injector should be listed on one of those two websites.
hundred percent.
At minimum, they need to
It's a
be.
very minimum. At the very minimum, they need to have healthcare.
And if they are not listed on that website, that is a basement illegal injector. I'm sorry.
Yeah. But I know of a rep
I was shocked.
with a
I was flabbergasted
very
when you told me that.
popular, well, you love it, a very popular filler that does all of the training and is not qualified healthcare professional.
You can't have proper insurance if you don't have that license. So
But when I found out about it, I just kept thinking, how is a filler company backing that and okay with that? Having a non healthcare professional involved in those kinds of things. To me, that's not okay. But that's just me because it's Canada. And whether or not they have a background in nursing somewhere else, they're still not legal,
I don't even want to do my own Botox.
right? So, what if something goes wrong in a training? Are you then backed up by the training? That then fall on the filler company? There is honestly one of my cousins has told me a story about her boss who does her own Botox and her own lip injections by herself at her house. I'm not even kidding you, like 30 minutes away, and does it all the time.
Someone I know of actually went to a basement injector here in Halifax, uh, who is no longer practicing. Well, questionable. Who is no longer practicing. Um, and actually got a vascular occlusion from this basement injector. And the occlusion happened immediately. She was blanching, and like while she was injecting her, while she was in the chair, and she apparently attempted to dissolve it with saline because she obviously did not have hyaluronidase on hand. Um, Obviously, that did not fix the problem. So this girl ended up in emergency, and she was modeled down to her
That's
neck,
terrifying.
um, and almost lost her bottom lip. So
And if you're going to basement injectors, just like you said, these kinds of things are not, and we've touched on it. They, if that kind of thing happens, even though the chance is very low, they're not equipped, clearly, to take care of these kinds of things. And you send them to the Emerge, who then are not equipped to take care of these kinds of things. So then, what's the next step, right? That's terrifying.
it's scary. It's very scary. And I feel like a lot of the side effects that we see online, like there's a higher incidence of these because there are so many basement injectors around the world. Not here, but um, as we mentioned, it is not regulated in many places.
There are a couple of
So
injectors that I follow from the UK because I know that it's bad here in Canada. Like there are those instances that happen, but it is literally every single corner in the UK. I follow it and my mind is blown, some of these people and what goes on with
Mhm.
some of these basement injectors because they're not qualified to handle the medical implications that can happen with these treatments. Like it just mind blowing.
That is, it's actually just so scary to me. Honest to God. Like, if they were to have an allergic reaction or something, there's no way they're equipped with like epi, and there's no way, right?
And
Like,
if by some chance they are, then what are they going to do next? Like what's your next I can't I can't wrap my head around that. I really can't. I can't. It's hard for me. So
yeah. And it's unfortunate. And I know earlier you said you're not bashing anyone. I am. I'm gonna sit here. If you are knowingly injecting substances into people's faces and knowingly not equipped to deal with the consequences, the things that can go wrong, that is just
well, it's
downright
not only selfish,
selfish.
but it's stupid. It just takes
What
all
goes hand in hand.
it just
Yeah.
there's no
Yeah.
there I know I said I wasn't gonna bash anyone either, but I mean this is my channel. No, I'm just kidding. That's what I do. No, but honest to God, like this kind of stuff that when it's happening, I can't. How can you knowingly? I for the first I think I would say year and a half of injecting, I literally panicked anytime I did any kind of filler. Panicked. Like literally
Yeah.
and still to this day, I connect with my patients who ever have filler at least once a day for 5 days in a row. And then when I don't hear from them, I'm like, we're good. Like, I literally will message them. I'm so ridiculous because my mind will not stop until I know they're okay. But
Yeah. I don't think there's anything
these
wrong with
kinds of,
that. There's nothing. There's nothing wrong with
right? I'm
checking
a little
in.
much. I mean, you could ask my clients, I'm a little much.
No, but they probably love you. Like, I love when you message me. They
Oh,
probably love it too. You
God.
know.
But like really, these people don't understand. If you're seriously, there's often times that I question myself, and then I go back and I look at either literature or I bug Jen, right? Because if I don't know something,
Right.
I'm not playing with somebody's face because that's a risk I'm not
Right.
willing to assume. It's not. And then think
Right.
about it. These basement injectors, the only way that they're getting in trouble is through legal proceedings. When somebody's had enough
Right.
with their crap or something really bad's happened.
Right. So if we do something wrong, then we could get our nursing license taken, which is not only taking, like, that is my business, right? And then I've not only wasted that, but my entire nursing degree because I can't go back and practice in the hospital without a nursing license. So I guess we have a lot more to lose in that way. But yeah, these people just, I don't know if they just have nothing to lose or like, well, clearly, because why would you risk that? Uh,
I'm like, sometimes I don't even feel like I fit in this industry. I'm like, God, what am I doing? Do you feel like sometimes I feel
I
like
don't,
that?
I feel that way, but I really don't care because I think that's what sets me apart is if my clients come to me and, for example, if they tell me an embarrassing story, I'll tell them one more embarrassing about myself. You know what I mean? So I don't know. I've always been that way. I have like,
I'm like, it's just
I've always been a gabber and a blabber. So
same. I literally get to know my patients way too more, and they get to know me too, right? They know my home life
yeah,
situation. They know everything that's
yeah,
going on with me.
yeah, everything.
So if
Yeah,
you
love
were
it.
a consumer that is potentially going to this basement injector or is looking at a basement injector but doesn't know, how would you how would you navigate that? How would you not go to a basement injector? What are the things that you need to identify?
Oh my gosh, this is gonna be a fun fact actually because after I had my course, and I feel like I should have known better, but it's so broad and unclear on the College of Nursing. There's like one PDF that's like a Q&A for cosmetic nursing. So I actually messaged a basement injector as a nurse because I was like, if she's doing this, how can't I do this? And it's because I have a license to lose. That's why I can't do that without a medical director. But they market themselves to look so like professional, and like there are training courses, like there are courses that will train anyone. Like you can be anyone and take a course from them and have that certificate. That certificate means nothing. Like it means something, but at the end of the day, it means nothing. Um, so for me, now knowing what I know, but just disclosing that even as a nurse, like I couldn't tell the difference. And so I never blame people for going to these places because some of them are so good at hiding it. But it's really important to check like your local college website. You can search first and last name or even sound alike names. The website's really cool and the search engine's like very easy to use. If they're not listed on either of those, then run immediately. And then your second step would be to see if they have a certificate, um, or a course that they took, or if they've ever done like one-on-one training with a medical director, for example. Um, Personally, I took a course where you literally only inject like half a face and you're paying all this money. And versus me doing a day full of training with my medical director, I don't get a certificate for that, but you get 10 times more experience because you're doing all the hands-on for a full, however many days you want. So you can have training without a certificate. So I would just ask them about training and stuff like that. Reviews are also really important. And before and after photos. If they're not showcasing their work, then what is the reason for that? This is reportable. So if someone is impersonating a physician, calling themselves a doctor, and they are not on the College of Physicians, that is reportable to the College of Physicians, as well as Health Canada. You can report to as well.
Be very, be very, very mindful. And I'm going to end this episode with what I've already told you about is what does injecting that East Coast charm mean to you? I'll tell you what it means to me. And then maybe you can draw off of that. But like for me, East Coasters are known for being very friendly, very welcoming, very open. And when it comes to injecting East Coast charm, is just that. When I have patients that come in, I want them to feel comfortable in my chair, in my room, in the environment, and with me. Because if you're not, that's not that's not what I'm trying to.
100%.
So when I say injecting East Coast charm, it really means that welcoming, family oriented. Like when we think of the East Coast, if anybody's never been to the East Coast, you got to understand that we will literally welcome people into our homes without even knowing them. Give you the
Right.
shirts off of our backs. We are the friendliest people in Canada.
Tell you embarrassing stories about ourselves. Just meeting you. Hey, this is the most embarrassing thing that's ever happened to me. Let me tell you all about it. Yeah.
Unsolicited. No, I'm just kidding.
No, yeah, yeah.
But really, that's what it
Unsolicited.
means to
Love
me.
it.
So I'm just curious what it means to you.
No, I would 100% agree with that.
I feel
That,
like you and
yeah.
I are on the same page when it comes to.
Yeah, and that's how I felt, and that is exactly how I felt when I first met you. It's like you have that East Coast charm too, you know what I mean?
We got that homey sense, and then we figured out that we
Yeah.
were cousins. Thank you so much for joining me for my first ever episode.
I know, this is so exciting.
Low key, I just want, if I help one person in this industry, I feel like I've done a good job. Or if I make somebody feel like they belong in this industry.
I think it's really important for everyone in your area to be like sort of on the same page. All the injectors. Yeah. Competition happens at the bottom and collaboration happens at the top.
But you were chosen first for a reason. So thank you.
Thank you.